Hey guys, welcome back to The Purpose Nurse. If you have been on my channel before, but if it is your very first time, then welcome. So right now I'm going to be discussing with you all how my second day in med-surg B clinicals went. So last Monday was my first day starting clinicals for the spring quarter, and I was in the ED. So if you haven't watched that video that I posted on my clinical vlog series, you can click the tag. It should show up somewhere above so you can watch that video. But I'm gonna go ahead and get into this one because y'all, I just got off from this 12-hour shift and your girl is tired, but I'm committed to sharing my journey with you, so I am gonna do that. So FYI, when I came in, I started the dishwasher because my dishes needed to be washed. So if you hear some noises or anything like that, just know it's my dishwasher. So today was awesome, y'all. I'm not even gonna lie. I'm so blessed to be working at the hospital that I'm working at, as far as like having clinicals there. It's just truly amazing. Everyone in the hospital is very nice and willing to help and things like that. So today I was on the med-surg floor, and I was actually paired with an amazing nurse. She's a new grad, and I believe she's only been a nurse for I think about 4 months, but she was absolutely amazing. When you do your clinicals at some hospitals, you never know the type of nurse that you're going to get paired with. You get some nurses that are awesome. They're like, yes, I have a student. This is cool. I get to, teach somebody, and I also get to, like, make sure, I'm still doing this stuff the right way is the frame of mind that, some of the nurses are in. But then you have other nurses that are just like, I really don't want a student because, a student is going to slow me down. So just be aware of that. And regardless of which type of nurse you get, just roll with the punches, because as future nurses, I mean, that's what you have to do. Everything is not going to always be set up perfect for you. So being flexible and tackling things as they come is the best way to be, and to just be open-minded. And I'm still learning that myself as well. But back to the nurse I was paired with. She was awesome. So I had to get checked off on 2 skills today. So one was medication administration. So that's just any medication that the patient had, whether it's PO, which is by mouth, sublingual, which is underneath the tongue, or IM, which is intramuscular, or sub-Q, which is could be in the stomach or anywhere where there's like a fat layer, like the arm, the love handle area, or anything like that would be considered sub-Q. And the other one was IV administration. So this is simply hanging a primary bag of an IV solution, whether it be just normal saline, or hanging an IV piggyback, which is basically a smaller bag of medication, typically like an antibiotic or something of that nature, and you're hanging that, and then you are lowering your primary bag that you have, which may be like, say, normal saline or something like that. So the nurse that I was paired with, I was able to tell her, like, hey, and introduce myself and let her know, I'm a student from UCLA School of Nursing, and I would be with her for the full 12 hours, and that there are these competencies that I need to get checked off on and everything. And she was just really awesome. She knew that I needed those competencies because I expressed it to her. So, if an opportunity came up, she's like, okay, this is a, simple med to give. You want me to hold this really quick, and you're going to get your instructor so you can go through the steps and get checked off. And I was like, yes, that's amazing. So I was able to get checked off on that. And then I went ahead and did my IV administration. So I did an IV piggyback. So once I did that, I was able to go ahead and administer whatever medications with her, with the patients that she had. So this nurse specifically, on this unit, all the nurses have 5 patients, so it's 1 nurse to 5 patients. So I took like 2 patients from her and was going between caring for 2 patients. And yeah, it was really awesome, you guys. Just the things that she was allowing me to do and teaching me and talking to me and asking me if I have any questions, and if she had another medication to give, you know, letting me give it. I also had the opportunity to discharge a patient today. That was super cool, at this specific hospital. Just learning how that process goes, the things you need to get together, having the pharmacist come up and speak with the patient about their medications that they're going to be going home with, and printing out any discharge paperwork, and going to the patient's bedside and going over that discharge paperwork with them. It was just a really great day, and it was just awesome to experience it, because nursing is not easy. Nursing is a difficult but very rewarding career. And I think for me specifically, although I do have experience, is that, again, nursing is a lot, and I want to be the best nurse that I can be. And so today was very refreshing to meet a nurse that is just on it. And I'm telling you all, like, I would have not known that she had only been a nurse for 4 months. Like, her confidence was amazing, and the key thing is she knew what she was doing. Now granted, she had been a CNA before for I think like 6 or 7 years, and I want to say she was an LVN too, I can't remember, but definitely she was a CNA for a hot minute. But still, transitioning into the role of a nurse from a CNA, from the LVN, like it's just different. So yeah, that's about it. Today was just awesome. Like, it was a really good day today. So not next week, but I think the week after that, I would like to go to the OR, so that'll be super exciting, and get to see surgery done and see the different roles of the nurses that work in the OR, such as like circulating nurse, scrub nurse, the surgeons that are there, seeing the residents, and stuff like that will be really cool. But that's all I have for you all. Again, today was such a great day, and yeah, I'm tired, but I'm still like on this high from today, because I love this clinical location, and I love my classmates that I am with at this location as well. We all get along really well, help each other out, very supportive to each other, and we want the other classmates to really learn and divulge, because that's how you become a great nurse. You become a great nurse by asking questions. You become a great nurse by putting yourself out there. You become a great nurse by learning new things, and you become a great nurse by accepting constructive criticism, because none of us are perfect. Like, none of us, you all. So I hope you enjoyed this video. Please like this video if you enjoyed it, and please don't forget to subscribe. If you are loving the content that I'm putting out and sharing with you all, then just go ahead and subscribe. Just subscribe, please. So yeah, I will see you all in the next clinical vlog. Until then, be blessed and be purposed. Bye, you guys.